Welcome, everyone, to iAfrica Media, the biggest media platform for all things eye care on the African continent. I'm Obi Malope, an optometrist based in South Africa, and today iAfrica Media has got the awesome privilege and the opportunity to be in Cameroon with one of the most inspiring eye care leaders that I have come across here on the African continent. If there's ever someone that I can think of who represents brand Africa from an eye care perspective in such a big and tremendous way, the way this incredible doctor does. And that is, of course, Dr. Ayukotang. How are you today, Doc?
Thank you very much. I'm doing very well by God's grace, and irrespective of the challenges, we keep on raising our heads high to our community.
Absolutely, absolutely. Doctor, a lot of people are not aware, but as I'm speaking to you right now, I'm communicating with someone who was inducted as a fellow into the American Academy of Optometry. That is a massive, massive achievement. So from Africa Media, congratulations to you, because you are literally setting the standard up here so that the rest of us can follow in your footsteps.
Thank you very much. It's been an honor, and we keep on doing this. We can do greater things together. It's an honor to be, a fellow of the American Academy of Optometry, one of the I am very humbled, and it's an opportunity to share and learn knowledge and to see how we can improve Africa, especially through the optometric platform. Yeah.
Wow, congratulations, congratulations. Dr. Ayu, for someone sitting in Kenya, someone sitting in Morocco, someone sitting in South Africa who is not aware who Dr. Ayu is, do you mind just going into like a brief introduction just to tell people who you are? How did you end up becoming an optometrist? What are you currently doing in Cameroon and the rest of the continent?
Thank you very much, my brother. I am a Cameroonian-born optometrist, but an optometrist for Africa and the world, not just for Cameroon. Privileged to have so many hats that sometimes I don't even know where to start, but I'll just try and summarize as much as possible. President of the Cameroonian Association of Optometry, and privileged to be what they call the father of optometry in Cameroon. On the African Secretary General of the African Council of Optometry, and will be shortly presenting my humble candidature for the next coming to see how we can continue the work we are doing for Mother Africa. On the World Council, in terms of the World Council of Africans Optometrists at the World Council of Optometry. I'm a Commonwealth scholar. I was trained in Ghana. You see, I'm a kind of Pan-Africanist optometrist, you know. Become an optometrist. Growing up as a child, it would shock you. My landlord was a community leader. Then he had some knowledge in eye care. So it was so amazing as a child growing up, and I was people coming to him with a lot of eye care issues, pains, worries, and they leave his house very satisfied. Wow. So just taking care of people's eyes, you can change their lives and give their life a meaning. That is when the desire and the passion to see I can become an eye care doctor as well to help my community and the people. Unfortunately, in Cameroon, then to become an eye care personnel, I was so worried from primary, secondary school. I keep on disturbing my lecturers. How do I become the answer? So I took a journey to Ghana to study medicines, general medicines. Then when I got to Ghana, I discovered a doctor of optometry. And they say it's an eye care personnel an eye care specialist. So I switched from becoming a medical doctor to become an inspiration, of which then Ghana held so many caps too. I became the first non-Ghanaian to be a college president in Kwame Nkrumah for the well-being of all and my community. And I decided to come back, to Cameroon to see how I can contribute to with integrated people-centered eye care as focus. So we came, the association was not registered in Cameroon. Aspect for it to be registered and recognized both in Cameroon, Africa, and the world stage. Then there was no training, and is to have my second degree and PhD, just to see how we can have a platform to also train young Cameroonians and other be well trained to help provide quality eye care to our communities. So far I'm pushing for, and I'm hopeful that it's going to be 100%. And in Africa, I'm privileged to be the chairperson of which together we collaborated with WHO and ACLO and Vision Impact. We set up the first to see how we can disseminate the recent World Report on Vision for the benefit of every eye care practitioner. And I'm also privileged to be a member of the World Council of Optometry Public Health Chair Committee, whereby we strategize the most needed challenges of eye care services, not just in Africa, but the world over. Just to brief.
Wow. Wow, that is incredible. And I'm sure there's someone who's going to be listening or watching this interview that we are doing with you, and they'll be like, wow, I never knew that as an optometrist from Africa, I can get involved with so many aspects of various activities, initiatives, organizations, institutions, companies, both in the public sector and the corporate sector, that are beyond the practice room. You know, some of the times as optometrists, we are always thinking that the only way to get involved with optometry is within the practice room. But what you have alluded to right now is that there's so much to optometry that goes outside of the optometry practice itself. So thank you very much for being an inspiration. And I'm sure that you're going to have a lot of young optometrists from all over the continent who are going to reach out to you, trying to get involved in all these areas that you are involved in. Because one thing that for me, when I look at you, when I communicate with you, I see a tremendous leader. I see someone who is paving the way for the next generation. Yes, you are still young yourself, but you are so passionate about eye care, you are so involved, that it leads me to my next question as to what is the current state of eye care on the African continent?
I just want to thank you for those wonderful, kind words. And I want every African optometrist over there to know that your location, complex or culture or complexion, to be precise, should not limit you. You can make it wherever. Break the barriers, break the limitations, and you can become whatever thing you wish to become. I'm open for mentorship. I've been mentoring to see many giants. You can only leave a legacy when you can have people that you can mentor to be better than you.
That is so true.
Current state of eye care practices in Cameroon, in Africa. Yes, I want to take it in an angle with first being the human resource in eye care, the next being facilities and infrastructure. We can have the integrated people-centered eye care. Now, when it comes to human resource in eye care, positive, but more so in the African continent, there is a high, not just huge, but very huge care, especially in the Central African sub-region of Africa. You know, we have very limited meet the huge demands in eye care services of our population. And mind you that eye care is some eye drops, probably cataract surgery. Eye care is vast and it is an interdisciplinary kind of, to be provided to the people. So we have huge paucity of human resource in eye care. And my brother, 50, half of the world's population will be diabetic. By 2050, half of the world's population will be myopic. Diabetes is a chronic disease that is very dangerous. It affects the eyes greatly. If the half of the world's eye diseases, who are the persons or personnel to treat these diseases? That is a huge question for all of us. That angle. Then coming to myopia, we've all centered on near work gadgets, lab, a huge myopic shift. Half of the world's population will be myopic. Where are the personnel to take care of these people? So there is a need for our professionals, optometrists, ophthalmologists alike, to work towards, and I use this platform to plead to governments, industries, to see how we can strengthen the training of quality eye care personnel to meet these use needs that are population. Now, moving on to the next one, which is the facilities. It will shock you that in most countries, most of their less than 5% of the district hospitals do have eye care service.
Sure.
Now, most people will live in the hinterlands, they need eye care services. What do? They have to travel long distances. They have to even spend more than walking towards a district hospital that have an eye care services. It is appalling. It is very worrying to see such. Now come to the aspect of systems. We have systems that need to be improved to provide comprehensive quality. Then the last one, the integrated people-centered eye care. It's unfortunate we have most of the eye care services also, and in the cities, their services are very, very expensive. It is not integrated. Most of them go into selling and making money. Think about that poor mother that probably is a widow in eye care services, because quality eye care leads to improve the productivity of one. That mother has to travel from a suburb, probably about 30 kilometers, to come to the city. She must have routine checkup for 2 years, and she will pay more than half of that saving just for transportation, lodging, feeding. Then she comes to the eye clinic in the city. The accessibility, no system. She has to pay from her pocket. And probably the services, the exams that she has to, that she could not even finish the exams process to know what is wrong with her before thinking of intervention. She might not have to travel back to her home to go and wait probably for another 2 years to come back to get intervention. For those 2 years, if involved in tailoring to meet ends, she will not be able to use the needle. She will reduce her productivities. If she was doing, say, 10 dresses a day, she could do only 2. She will lose customers. Her family, quality eye care. There is need for us to revisit this as people of good conscience.
Sure.
Quality eye care services in the community. So that is the state in Africa now. Much has been done, not discrediting what has been done. work to be done.
What are some of the strides? I mean, you gave us a good breakdown of what actually the eye care landscape currently looks like and some of the challenges that we are obviously facing as a continent in many parts of the continent. I mean, even the countries like South Africa and Nigeria, we also have those similar challenges as you will find in the central parts of Africa. Now, what are some of the strides then that you believe we have made in addressing some of these challenges? Where are we in changing the narrative, changing the way things are, where they were 5 years ago compared to where they are right now, where they were 10 years ago compared to where they are right now? What are some of the strides we have made in changing the narrative regarding eye care on the continent?
That question, just as I was closing in the first question, much has been done, though not that much. So far into 3 segments of a decade each. You know, there was a segment in eyecare 99, not just the continent, globally, whereby eyecare personnel were struggling. You could have one ophthalmologist. Sometimes there are countries that didn't even have even one eyecare personnel, to be precise, and they have to move to other countries to, you know. Now, after post 1999, we had hope when we have Vision 2020. Governments begin to sign, you know, treaties and begin the eye care body like IAPB started engaging. We had NGOs that had to move into countries to see how they could partner with government to set up some eye care shops, clinics, or whatsoever, to be able to service the needs of the population. And it was good. It was good. And before you know it, we 14 thereabout, whereby we realized that what we planned in 1999 was not that much gap. 2014, 2019, that was very ambitious and prescriptive. Going to reduce the burden of visual impairment to about 25%, but how to go about it was very challenging. And key in and they contributed as much as possible. And now we have the birth in 2019 of World Report on Vision. It's like we can see how we can use this document to fit in the context of the various locations besides in Africa. So in terms of human resource, we are still far behind. Far behind. There are countries whereby, I'll use my country for example, we are about just 10 optometrists in a whole country of about 26 million. That is, and the ophthalmology population is about 100 thereabout for a population of 26 million. Then we go back to, we need to train more people on eye care. We need to talk to medical students. I'm privileged to be lecturing in one of the leading Anglo-Saxon students. Do you know about eye care? No, I taught them a course on physiology, and I used the opportunity to let them understand on and become an ophthalmologist. That is the little we can do at our own corner. We can also look into how we can promote and encourage. In my own humble view, like using the situation of Cameroon, we attend. I want to see that, okay, probably in 2 to 3 years' time, we should be about optometrists. How we go into more training. Then the infrastructures, we need the government than 20%, to be more precise, of most district hospitals in the country that do have an eye. We need to talk to government and other important stakeholders to see how we can set up eye care services. We train personnel, put them there to the system. The issue of system thinking. You know, you want to go to the national level, at the level of the minister of is being allocated to them for health. They could have something, for example, say for about 5% of the GDP of a nation being allocated to health. We need to see how we can add voices to help the ministries of public health in our continent to see how we can convince the law and policy for healthcare services. Without health, nobody can function in any other sector in our country.
True.
Then when you go now to of the money is being allocated to infectious diseases, yes, they are very important, but there is no that is less important. What percentage should they allocate for eye care? Almost nothing. It is high time we get done to wait for people to get blind. Mind you that any person that gets blind, it reduces the person's, it affects the productivity of a nation as a whole. So that is the importance of eye care. So much has been done, but much we need to set good eye health system, mostly integrating universal eye care into. It is very important to see how we can integrate eye care into the mainstream of health so that together we can reach solving their problems as much as possible. Yeah.
Wow, we've got so much to do as a continent. Where do we then come together in collaboration? Because obviously
Definitely.
What you have alluded to involves many stakeholders from both not only government, the private sector, the public sector, the eye care community as a whole, whether it be optical dispensers, ophthalmologists, and optometrists. Where do we then collaborate with each other from country to country? How can we then foster that collaboration far quicker than what we are currently doing right now? And the second part of that question will then be the suppliers and the corporates, your lens manufacturing companies, your contact lens manufacturing companies, your framing manufacturing companies, as well as your diagnostic equipment manufacturing companies. Are they doing enough in bridging the gap or the gap that exists in the eye care related problems that we find ourselves in on the continent? Where can we collaborate as the first part? And the second part then becomes, what is the role of the corporates within the eye care industry on the continent?
Thank you very much for that great question. Now, the issue has eye care personnel at the different card. They don't talk to each other. They rather talk against. It is high time an ophthalmologist should know that they alone cannot do all. They can't be everywhere at every time. They need to start talking to the optometrists, and the optometrists need to start talking to the ophthalmologist selflessly. And as well as not forgetting the junior card, such as the ophthalmic nurses and the opticians, have interest in terms of the names and the certificate we carry. We went to study to see how we can bring solution to the community, and the all about ourselves and the money that people will make or the ego. No. I listened to one, I have come across, it beats my imagination that the higher you go, the more you understand that what you are fighting for is baseless. So Covinedo from South Africa, how selfless they are, they don't carry names and title. They think about the community. Across Professor Sedge of France is in IPB. He's a great ophthalmologist. He said, optometry that is complicit or complicated or complex and does not want to see the other card, knows that they are empty. And two, they don't have the self-confidence. Because if you're confident of what you can do everywhere, then you go into tax sharing and tax shifting. Because it's not about yourself, it's about reaching out to the population. So we need to start talking That is why if I'll be privileged by the AFCO community, that's the African Council of Optometry member countries, to give me the opportunity. One of my goal is to have an all-involved and all-inclusive kind of approach. We'll talk to in Africa. I have good friends in some of those places, and see how we can build bridges. It is about eye care. It's not about the optician. Like now, I'm talking to the opticians in my country. They are more than us ophthalmologists. We are talking and see how we can advance eye care. Forget about our training, our names, and our certificates. Let's forget about that. It's about eye care and how the people can benefit. So we need to, and from there, when we are stronger together, we can approach policymakers and lawmakers with more strength, and they will listen. And when we place our demands for the sake of the people that have voted them into those places, then they need to respond before they became elected. Now, we go to those suppliers, the industry in eye care. So much wonderful work. However, some have been, kind of so much about interest services. But if we take out of the equation eye care personnel, they will not have the platform services. So if the eye care providers, practitioners, providers come together, form a team, and let them know that the product and services that they are providing, if they work together with the eye care personnel, we can create more persons, give the appropriate intervention, and together we can give them what we call the comprehensive universal, all in it. Thank you.
Wow, thank you very much for that. You've literally sort of like broadened our perspective in terms of our thinking when it comes to the way we do eye care or the way we provide eye care on the continent. A question then becomes, from an academic level, do you believe that every country needs to have an optometry school? Or do we have enough optometry schools for the needs of the continent right now? South Africa, for example, has 4. If I'm not mistaken, you studied in Ghana, and so Ghana had 2 academic institutions that were providing for eye care. Same applies with Kenya. Countries like Namibia don't have an optometry school. Countries like Botswana, they don't have optometry schools. Many of those African countries have optical dispensers or opticians being in the majority, but not enough optometrists, let alone ophthalmologists in those countries. So should we be having more optometry schools? Because you keep on mentioning the aspect of training and development quite a lot in a lot of your responses. What are your thoughts regarding optometric schools at the current moment?
Excellent question. It's need for more training. Now, when we talk about schools, it's not only about the quantity, but the quality. I maintained 2 schools, and the quality is standard. So, if you ask me, yes, every country at least a quality optometrist could train good optometrists that will go and serve the population. Unfortunately, being exposed on the African continent now for almost a decade, it's not the case. There are countries that some of them you've cited that don't even have. We have been talking, and it's one of my passion, honestly speaking. And I just I'm the hard work that such people are doing. There is Professor Chwani of South Africa, is the AFCO deployee to the World Council of the Education Committee. You know, she has been working very hard, as well as Professor Vanessa of South Africa too. Education, optometric education. These professors have been working so hard, and we are trying to think about how we problem is the harmonization of curriculum. Because somebody is trained, there might be many schools, but what is the level of the competence according to the, what is the impact that they provide? Is it at level 3, level 4, which is therapeutic, level 5? It's a huge question. Of Cameroon, what we are doing, when we started the optometry school, we open up to Africa. Those who cannot be able to start up the optometry school as immediately, the training more accessible. And we had students from Botswana, and I might still use the same platform. Those who probably had just diplomas in optometry to all this, we are very open in Cameroon to welcome them in and train them with quality. We have lecturers from Ghana, Nigeria, the very best, so that we want to see how we can train optometrists in those countries and help them start their own quality human resource in eye care, so that they can better service their community. Yes, some other countries. It's been very painful when I communicate with optometrists all over the country, and of, oh, we don't have for school, we don't know how to go about it, and we are sharing our little knowledge we know about advocacy that will help them. And I forgot to mention Somalia. With all humility, we also reached out to Somalia and helped them with improve on the quality of training. So that is what we've been doing, and we think that we can do more. As I mentioned earlier, not campaigning, but fraternity in Africa can give us this privilege to be the next president-elect of AFCO. We are going to communicate. We are going to work to academia. We work together because of their deep knowledge in it and experience. We see how we could harmonize curriculum. 2 days ago, I went through the American Optometry Association page, and I saw how it has evolved in America. It is so mind-blowing, and I'm just so happy, and I appreciate the work doing. An optometrist is not limited to glass cutting or selling, no. Especially when you are at the level of therapeutics, say like you are a medic, to be honest. As a doctor has to come in full package. But knowledgeable in healthcare services. In America now, they are involved in vaccines, they are involved in pre and post surgical management. This is very what for lack of words, it's very exciting. If we don't have optometrists of this quality and caliber, people are suffering and dying. Eye care case cause death, yes, many of them. For example, if somebody has a reduced visual impairment, that person might be traumatic injuries that can lead to death. That is the importance of eye care. So yes, we need to see how to come. Forget about our levels and see how we can harmonize curriculum, strengthen young schools. We had, as AFCO, and I've been privileged to spearhead that, reach out to WCO and see how can we do optometrists like in the Northern America, not to help us. Let's work together to see how we can improve academia. And books, the optometrists that can easily access books and instruments over there than here in Africa. We collaborate to strengthen the optometry school. And we're happy that WCO had linked us with Bosch International as an African. We can strengthen optometry schools in Africa, especially the young ones that are coming up, and see how we harmonize curriculum competency to serve Africans. Africans, we deserve the best. Yes, we do.
Wow, that is incredible. One thing that inspires me from what you are saying is that as much as there are lots of challenges on our continent, those challenges are presenting opportunities. So for as long as all of us are willing to get our hands dirty and say, you know what, I want to make a difference. I'm not comfortable with seeing people around me, people in my community, people in my country going blind unnecessarily, whereas we can actually do something to prevent the level of blindness, because a lot of problems that we are facing can actually be prevented. And that's requiring the level of standard of eye care that is being provided to literally be increased. So that provides an opportunity at an academic level, at a clinical level, at a business level, at all different levels of eye care as a whole. There's so much that can be done. And if we can collaborate, work together, and have one common objective as a continent, I believe that a lot of these challenges, we will be able to overcome them far quicker than what we are currently doing at the current moment. And so, as Africa Media, we hope that we can be a platform where the different stakeholders can actually come together in communicating with one another, because it starts with communication. That a lot of the times people are working in unisons or in isolation as opposed to working in unisons with each other. So we want to bring people together because what you guys are doing in Cameroon, what other people are doing in Tunisia or Egypt or Morocco, we can all learn and benefit from one another. I was recently had a webinar with two ophthalmologists, and both of them were emphasizing the need for fostering better communication and collaboration between optometrists and ophthalmologists at the pre and post-operative levels, because it's not the patient of the optometrist or the patient of the ophthalmologist. The patient belongs to the eye care professional. So if we can work together as the different professionals, we are able to be in a position where we are assisting the patient far better. And when that results in better outcomes at the end of the day. So what you are highlighting in terms of areas from a human resource aspect, from a facilities and infrastructure, from a policy level as well, those different levels, I think you are actually calling us to get more involved. I think that's what I'm getting from your message, is you are saying that, guys, let us not be comfortable with the status quo. Let us get uncomfortable and get our hands dirty. So thank you very much for that. If there's anything that you believe that we can help you with in your journey as an impactful leader, please don't hesitate to get in touch with us. We are here to serve as iAfrica Media. We are here to help people like yourselves, institutions like the ones that you have mentioned, be able to fast track the work that they're doing. And so we look forward to what lies ahead as an industry, as different bodies within the eye care industry. So thank you very much for that, Doctor. As we come to a close.
Thank you very much, my brother. And just to say something from what you just mentioned. Yes, I want to appreciate those ophthalmologists that came on your platform for the wonderful ideas they suggested. Now, I want to plead with eye care personnel. Let's move from sugar talking on media and go into action. Absolutely. As you rightly said, uncomfortable with the status quo. Let's not just talk well on media, be it social or mainstream media, but let's go into action and talk to each other and forget the barrier. Because from the World Report on Vision, 2.2 billion people are living with visual impairment. And out of that 2.2 billion people, about 1 billion are yet to be addressed or could have been prevented. And about 90% is due to uncorrected refractive error and presbyopia. These are common things within us. And about visual impairment, mostly in children, and I came across a write-up that in Africa alone, children who are having blinding diseases, it's about 300,000. That is from Fred Hollows publication. 300,000. That is just the population of Manchester City. It is very serious on this continent. We need to really talk to each other. And thank you so much for the opportunity given me. I really celebrate your hard work. You are somebody I've loved from day one. We met, we could connect easily, for your openness, for your passion. I mean, I'm very impressed. And I want to let you know that your books, my students are using your books, the ones that we got in South Africa.
Next time you
Very
come,
happy. And one of them that has been so close to it was the best in the clinical exams. Thanks to the knowledge that extracted from this Africa TV, keep on doing the good work, reach out to the eye care practitioners. Let's all get on board and get things done from Mother Africa.
Absolutely, absolutely. Thank you very much, Dr. Ayo. We really appreciate your time. And this will be only the beginning. This is only the beginning. I guarantee you on that one. For us, we reached out to you because
Thank you.
We see what you are doing, and there's no
Thank
way
you.
this just becomes a podcast that we just share on social media, like you said. It has to go beyond this conversation. So hold us accountable as Africa Media as well, because for us, it's not about likes on social media. It's really about getting our hands dirty and pulling the different people together. So thank you very much. Till we speak again very soon, let us continue to work together as best as we
No, thank you too so much. I didn't appreciate
it. Thank you very much. Thank you, everyone. That was another interview from Africa Media with the amazing Dr. Ayo. If you have not been connected with us on the different social media platforms, Facebook, Instagram, LinkedIn, make sure to connect with us, subscribe to the YouTube channel, and connect with us on the website, www.africamedia.com, and stay connected with all the amazing initiatives that are taking place on the African continent by amazing leaders all over the continent. Till we meet again, take care, everyone.